Good afternoon and welcome back to the afternoon session of the Digital Health Society's Summit. It's my pleasure now to introduce the next panel, which is Citizen-Controlled Data Sharing Governance. This session will discuss the main next steps to be followed concerning legal questions, societal issues, and business models based on transparency, information, awareness, and trust. I'm going to introduce Karina Dantas, who's a colleague of mine and is a international project manager with the ECH Alliance and gets involved in EU projects, one of which is Digital Health Europe. And she has considerable experience in data sharing governance. So I'll hand over to Karina. And sorry, one final thing. It is also a pleasure to introduce a panel comprising so many clever and intelligent ladies. Over to you.
Thank you, Vladin. Well, I have to say the selection was not gender-based, although it is now probably the most gender-biased panel in the summit. Thank you so much for the introduction, Vladin. Also, it is a pleasure to be here and to continue with the summit, which was so enthusiastic during the morning. I do hope we can cope to keep the discussion alive, even if it is after lunch. So I hope our audience and participants are as excited as we are to discuss this. So first of all, I would like to thank a lot to the panelists that accepted to be here. We have a very varied panel with 5 different experts that will help us to discuss the issues. I will make a brief introduction of each. Of course, it is a brief introduction, but you are free to go to the platform and see further information on the speakers if you wish to know more. So I would start by introducing Birgit Morlien. She is a policy officer for the G-Connect European Commission and works on the e-health, well-being and aging unit. Birgit will start by setting the scene for this discussion, and I thank her in advance for this availability. Then we'll have 4 other panelists that will be discussing the main conclusions, next steps, and issues to be followed up during the panel questions. It is, I will start with Nicola Bledington. She's Special Advisor for the European Patients Forum and also representing today the initiative Data Saves Lives. Iana Sinipuru is Project Director at CITRA, the Finnish Innovation Fund, working on a consent-based method of fair data exchange. Jeroen Maas is the Challenge Lead for Health in the Amsterdam Economic Board, where we focus on the use of data technology and artificial intelligence in supporting health. And Sarah Medjek is the chair of My Data Global Board of Directors and project manager at FING, and works on individuals' behavior with regard to the restitution of their personal data. So thank you all again for being here. It will be my pleasure to be discussing with you. I will very briefly tell to those that are watching us that we will start, we'll have like a twofold session, let's say. As I was explaining, Birgit will set the scene. So she will present some overview of the European initiatives. Then we'll have a very brief presentation of some of the preliminary conclusions we reached in the Digital Health Europe project. These will serve as the grounds and basis for the discussion. And then we will just start ping-ponging between all of us to see what comes up to our minds based on the different areas of discussion, and if we can at a certain point agree on what would be the next steps to be pursued for 2021 and on to be able to develop more on citizen control data sharing governance. So I will start probably to pass the ball to Birgit if you are okay with it. I will share my screen and show your presentation. Please let me know if you can follow it, and you can just tell me when you need me to pass the slide.
Okay, thank you very much, Karina, and thank you for the invitation to participate in this interesting session. Today, we are all living faster than expected the digital transformation of our daily lives. If you can go to the next slide, Karina. Long before this pandemic started governing our daily activities and our lives, the Commission had already put the digital age high on the European agenda, and more particular focusing on digital solutions that put the people first and that empower all of us. Next slide. And next to the technologies, we also have these ever increasing amounts of data that are produced and that create new opportunities and make our lives and work easier and better. Although with this data, we need to strike the right balance between the great societal and economic benefits of unlocking the data and the need for privacy and trust. Next slide. We can't ignore that our health and care delivery is already to a big extent data-driven. And EU citizens, they expect that their health data can be shared, but at the same time, they may not always feel in control of what happens with their health data and who is using that data. Next slide, please. We all know there is a wealth of technologies and digital tools out there, the smart watches, the smart pills, the sensors, where we can easily monitor our health and well-being and capture a lot of data. But what happens with this collected data and how can we access it? Well, don't worry, be happy, because with every device comes a different app that you install on your smartphone, and you have all your data there. I don't know how you feel about it, but that's not the way I want to control or to manage my daily key health performance indicators. I don't want this siloed approach. I would like an integrated dashboard where I can have a quick look on how I'm doing, and but who to trust to compose this dashboard and to keep this data for me. Are it the technology providers? Are it the insurers? Do we consider health data banks or the government? Who do we trust, and who gives us the necessary transparency to play that role? The next slide, please. And in this respect, I think we all recently learned a lot from the developments on the Corona tracing apps on the national level. They're all based on privacy-friendly technology, managed at the national level and then interlinked at the European scale. And we have a lot of experience that we can share and that we can learn of, because it's all about trust, transparency, and the human factor. And to end, it's not the technology, and the last slide, it's not the technology that's the issue, but the trust and the transparency and the human touch. And I want to end with some words from our president, that we will only succeed if citizens and communities are empowered to become agents of the transition. And I'm really looking forward to the discussions with you and to sharing experience and see how we can make trust and transparency a bit more tangible. Thank you.
Thank you so much, Birgit. And that was the perfect setting of the scene, I think, because we discussed a lot of different issues during this morning, but we wanted really to start the afternoon on discussing the main issues based on the citizen perspective. So I think we are perfectly on track on this. I will then just present very briefly some of the aspects that we wanted to discuss today. But first, I will just let you all know that my colleague Carolina is supporting me on the chat. And after our presentations and during the discussion, she will be picking up some of the audience's questions to bring into the panel. So if you have them, please start putting them in chat. Of course, we won't be able to address all, but we will try to include some in the discussion. So I will go back to the presentation and pass it on, if I can, to mine. So as we discussed before and briefly introduced, during the last almost 2 years, we have been working, of course, not alone, with a lot of different initiatives and organizations, and partially integrated in an H2020 project, Digital Health Europe, working on citizen control data sharing governance. And we did a different set of actions to try to gather as much information as possible on this. Namely interviews with experts, desk review, a large survey, and a series of events like today's. From this, I will just bring some highlights that can hopefully trigger the questions to be discussed. So Birgit presented a survey, the results of a survey. We also did one this year with almost 1,000 people in Europe. And I know that some of your initiatives have done relevant surveys as well. And we think that most of them are more or less aligned. What is interesting to know is that from the people who answered, and this was targeted for the common citizen, not for experts, 50% say that they don't know who has access to their data. They are not really sure who controls it. And of course, this means that they also don't know how to access it. Nevertheless, 80% state that they are fully aware that their health data may be of interest for research. And a lot of them, almost all, would agree to share their data with a university or medical research organization, a little bit less, but almost the same with a health and care provider. However, if you ask directly, there is a lot less willingness to share data with commercial organizations, even if they are health-related organizations. So this is, of course, something that I think can be discussed today. Two aspects that I also find interesting to trigger the discussion today. When we ask if people would be available to share their data, would they do it in what grounds? They say that 58% say that they would share it, but they wanted to know the situation on a case-by-case basis. So they really wanted to decide based on the case. However, 35% agreed to share it on whatever reason or context. Nevertheless, if you see the top graphic on my screen, there is a big difference in terms of the age of the respondents. If you go for younger respondents, they are much more interested in understanding the reason and going on a case-by-case, while most of the respondents over 65 are more willing to share whatever the context. And this is a bit related again with this other question that would be related to potential rewards for the sharing of data. Most of the people, 60 to 63%, are interested in just being rewarded by knowing the results of the use of their data. So providing feedback is probably the biggest interest. But there are also others that say that they wouldn't need anything, they would just share. And a small percentage of 10% that would consider a monetary rewarding. But if you go again to the top graphic on the right, you see again a big difference by age. So most of the respondents that said nothing are over 65, and most of the respondents that would consider a monetary reward are younger, are below 25. The same happens with the research results that are helpful for society or only helpful for my own disease. Again, there is more interest to understand the results in the younger population. Maybe this is also something interesting to be discussed. So based on the overall discussions on the project and on all the initiatives that DCH Alliance has also been working with for the last few years, we have a lot of preliminary conclusions that we want to discuss with key stakeholders. And this is a very summarized, and forgive me because summarized also implies sometimes light, 4 areas of conclusions that we are now currently wanting to understand with different stakeholders, different experts, and to understand if they agree, disagree, or how do they see that this can be consubstantiated for the next few years. So I would say maybe these would be the 4 main questions for us to discuss today. And the first of them is, apparently there is the need to increase citizens' awareness regarding the control of their data, who does it, how can they access, who has access, etc. And providing feedback is something that is certainly necessary. To do this, of course, there is the need to have governance models that allow them to access data, to control data, or to share data, a bit on the track of what Birgit was explaining. So do we find models that can be helpful for people to do this? This is something we have investigated during the timeline of Digital Health Europe, and we talked with several different initiatives. And what we understand is that there are several initiatives trying to address this, still scattered, still initial in a way. So one of the things we concluded was that possibly there is the need to implement them on large scale, different ones, and try to assess and evaluate, see how they work and what can be the results that we can extract from there in order to progress. Of course, that we can have the digital tools, but they can still not used. So there is also the human factor to consider. And from what we understood, trust is a big challenge.
Hello, Karina.
Challenge to overcome, and trust also implies, sorry?
I think that there is something with the sound. We didn't hear maybe the 30 last seconds of yours.
Oh, sorry, maybe the network broke for a little bit. I hope not, I hope not. Okay, so I was just saying that in order to have the implementation of any tools or any governance models that people can use, we need to have trust. And this is a challenge, of course. And for this, we need digital literacy and health literacy as well. And last but not least, one of the things that we mostly heard, especially from the common citizens, is that sometimes they value privacy, of course, but sometimes the consent guidelines and the consent forms are impossible to read or are impossible to understand. And of course, this also hinders trust, because things need to be clear and need to be easy and accessible to all. So I would now stop the presentation here, because I've talked enough and now it is for sure your turn. I would ask you to consider these 4 main questions. We can go back to them at any time, but probably the way to move forward was to ask each of you if you could just make a very short presentation of the position of your initiatives or organizations on this debate, and then address one of the questions that you saw here and that you think we can discuss. Please feel free to volunteer if someone wants to start. I see Nicola unmuted, so maybe you want to start, Nicola?
Fine, I'm happy to do that, Karina, and thank you very much for the invitation to this panel discussion. I think, and congratulations on the work that you've undertaken and the outcome of the last year and a half. I think a lot of the messages resonate very well with some of the work that EPF has been trying to drive forward in the context of Data Saves Lives, which is quite a recent multi-stakeholder initiative trying to really look at the challenge of raising awareness, building trust and confidence in responsible data sharing, initially working with the patient community across Europe, but then in time looking at the wider discourse in relation to enhancing public trust and citizens' trust. And it was interesting to look at some of the survey results in that regard, because it isn't clear whether the people who were interviewed were actually patients living with a chronic disease or citizens more generally. And that differentiation between the perspectives of young people and older people may actually reflect that, because older people will be actually more likely to be living with one or more chronic condition, which means their altruism to share and their confidence that this will go in the right direction and will actually be of benefit to themselves, to their peers, to future generations and to wider society is maybe more apparent than for younger patients or younger people who are fit and for whom actually the thought of living with a chronic disease is very, very far from reality. But coming back to Data Saves Lives, we're making an attempt to grapple with that through, I guess I say, a multi-stakeholder approach, bringing together data and digital experts, and IHD is part of the steering group. We have industry representatives involved, we have academia involved, and we have a number of patient leaders that are really driving this, which is fantastic. And we're looking at essentially three pieces. We're looking at a state-of-the-art web portal where we try and look at responsible data sharing in terms of quality, in terms of benefits, in terms of unpacking things like privacy, but trying to bring it to life with real life case examples, studies that people can relate to. And that is obviously growing on an ongoing basis. We also have a multimedia campaign that we're running primarily on Twitter in order to raise awareness on social media in relation to building trust and confidence, again with all of the techniques around social media to create that buzz. And we're also looking at building a health data community in order to be able to engage meaningfully at European level with things moving forward, such as the European health data space, to make sure that patients' and citizens' voice is really clearly understood in that discourse, and particularly looking at governance, looking at the governance of the European health data space, because unless you involve patients and citizens at that critical strategic level, there's a risk actually of missing a trick further down the line. When it comes to outreach, we're working with the patient community across Europe to really understand on an ongoing basis what their needs are, and also respond to those needs through a toolbox, resources, etc., to really be able to be sure that they're confident in engaging, and they can also act as ambassadors in a national context with regard to responsible data sharing. So I wanted to highlight a little bit about Data Saves Lives. As I say, it's still a very young initiative, but has the potential to grow. And to your point about the fragmentation across the board, I totally agree with that. And I think we all need to work together collaboratively in order to create that critical mass, because if different initiatives work in disparate arenas and make a little bit of impact, then that's a missed opportunity. So I fully endorse your messages around that, and I think that the Data Saves Lives initiative would be very, very happy to join forces, as it were.
Perfect. Thanks, Nicola. I would actually, I actually think your brief speech now and the presentation of Data Saves Lives makes a lot of sense if you connect it to the results poll of this morning, where most, for sure, more than 80% of the participants in the summit answered that the benefits and value of data sharing and health data use should be agreed on by a group formed of multiple stakeholders and not necessarily by one type of organization separately. So that makes much sense.
Sure. And also, just to add to your comment again, the results pointing to more skepticism in terms of data to commercial organizations. I think one has to differentiate very, very carefully here, because I think public-private partnerships, particularly in the context of therapeutic innovation, very, very important. And again, you know, obviously the holy grail is privacy and trust. But I think everybody needs to be part of the conversation.
Exactly, that's perfectly on the point. So who would want to pick up on Nicola's cues here? Sure, Jana, don't be shy. Please join in.
Okay, just continuing from the great theme, and congratulations for the study. It's pretty similar. We studied about wearables, how people in different European countries use wearables for their well-being, and I think it was like 55% of the respondents in Netherlands, Germany, France, and Finland who said that they used mobile phones or smart watches, smart devices that motivate themselves to exercise more or help them in their own well-being. So I think this is a very crucial topic to discuss about expanding, enriching the traditional data reserves with the person-generated data. But at the same time, I think that I also like this comment from Nicola and you that we need multi-stakeholder collaboration on the rules and guidelines. So what we are doing currently in our Fair Data Economy project is to work through soft infrastructure and standards for this consent-based data sharing that will benefit the society, companies, and individuals. And I think we need to focus on services that provide value. If we cannot return value from data back to the citizens or back to the patients, the data flow will also stop. So, of course, it's a matter of trust and privacy, but it's also finding those relevant services and developing relevant services. So we need to have companies on board who are skillful in innovating and bringing their expertise. And I don't think that we will manage for this very complex futures or by relying only on government officials or only on companies. So that's why I also like this topic you were mentioning, like for digital education and health education. It's not just for the citizens, but we also need to educate decision makers and professionals being more used to these new and richer data sources and giving recommendations to patients to use these new kind of devices. So I think momentum to discuss about these kind of topics is perfect right now.
Indeed, it's very true. So, Jerome, Sarah, any of you want to jump in and
Yes.
continue?
Thank you. So thank you so much for the invitation and thank you for the different presentations. So I actually wanted to jump in because there are several things that have been shared that really resonate with what we do and are definitely relevant. First of all, thank you for the presentation of the result of your survey. It's really interesting to see actually what people are expecting, but also to see that the result that you have also resonate with the result, for example, that we had the chance to have and to actually to be able to observe when we went through different experimentations. So maybe just to set the context, I don't know if everybody here knows my data. So my data is actually 4 things. It is a concept, it is an idea that the individuals should be empowered with their personal data so they can do something that is meaningful for them with this data. So we have been actually working on this concept since years now, but what is interesting is to see that while in France we were working on the concept that we called self-data, which is exactly the same than my data, people in Finland were also working on this exact same concept. And then we met each other and we created this community that is the second thing of what is my data. And my data is also a movement, because now we have been able actually to develop our thought, to develop our vision, to develop our mission, and to develop this community and network, and to be a movement that is that maybe represent what is the European vision of how the individual should be actually in control of his or her personal data. And now my data is also an organization. And the heart of what we do is actually about trust. And this is one of the things that you have been mentioning. Trust is definitely an important element, and this is what we want to do: empower the individuals with their personal data, so we can change actually the paradigm that is, that is existing right now, that companies collect personal data and use the personal data. What we want is to set a human-centric paradigm that aim to a fair, sustainable, and prosperous digital society where the sharing of personal data is based on trust. And trust is definitely important when it comes to personal data. But what we have also been able to observe through different experimentations that, for example, we have been doing in France, is also self-confidence is also important, because when we say trust, it means that we have actually to trust the companies, the organizations that we share the data with. If we talk about the My Data model, which means having the data back, we have to share actually the tools where we store our data. But at the end, we have also to trust ourselves as being able actually to handle, to manage our data, to protect our privacy, and to be able to do something meaningful with the personal data. Because I think that Jana was also mentioning this, we have actually, it's not only about trust, it is only about the meaningful usage of the personal data. Whatever it could be in health, but it's also relevant in different other aspects of our lives. For example, I don't know, education data, energy data, transportation data. Whatever it is, we need to do something meaningful, and we need to have services. But at the heart of it, it is the individual and the perception of the individual of trust toward other companies, but more specifically toward him or herself. And I think that this is definitely important, and also it resonates with what you were saying about raising awareness, raising the digital literacy. We have to give the tools to the individuals so they can feel able to manage and to handle their personal data.
Thank you, Sarah. So that's very interesting. And I think that at a certain point we feel all aligned, at least the ladies. So what do you want to jump in and tell us all?
Yeah, thank you, Karina. I think we are all aligned, also me. You have a very like-minded panel here. I think we all see the benefits that we can gain from, as we call it, the secondary use of medical data, while always having safety and privacy of the patient or the citizen in mind. I think we all agree on that. We might, you asked me to tell a bit about the program, the project we're working on. We have a little different approach here, because we're talking now about data sharing. And the approach that we're looking into is leave the data where they are, because that solves a lot of issues. Your data can't go around, no company can take it and resell it, or all those problems will be eliminated. So leave the data where they are, and send algorithms to the data to do a partial analysis there. And then get those partial analysis back and have a joint conclusion there. And that's what we're looking into now. There are some ground rules. They've already been discussed. I think, Nicola, you touched upon all of them. Patients should give their consent. They can retract it at any time. Citizens should know what's being done with the data. They should be able to tell, I want to have my data used for this purpose, but not for another. But we do need to reuse that data, because that's the only way that we can get forward and get a better health in the end. So that's why we are working on what we call, it's a working title, a Dutch health space with on top a data trust, an organization where we have patient representatives, just citizen representatives, but also I live in the Netherlands, so that might give a bit of color to this solution that I'm proposing. A government representative, the care providers, and they decide on who gets access to what type of data for what purpose. And then we should have some, like all over Europe, we have the same wall plugs at the moment. Well, except for the UK, but in the rest of Europe, we have the same wall plugs. We should have something very similar for those algorithms to travel from care provider to care provider. So we're building that within the Netherlands. It would be great if you could send them off to Finland, to Spain, to have even better and larger groups to do biomedical research on. And that would, if we have that infrastructure that's known, that we have agreed upon, then every health provider can just keep their data where they are and still, if they decide so, help in generic health research. That's what we're working on. And
Yes.
can I just touch on one question that you had in the end? You said we need to work on digital education. Yeah, and I think what's really important there is make clear what the difference is between Facebook, for example, and health data infrastructures, as we want to use it from a patient-centric perspective.
Yes, that's that's a good point to end with, actually, because if we are all agreeing, I need to find some disagreement points, because otherwise the panel won't be enthusiastic enough. I'm sure no one will be disagreeing with you, but on this last part of digital education. But let me try to spice up a little bit the discussion, at least because if I think that you are correct, most of us agree on the way secondary use of data can be done, but mainly we need to also discuss how can the citizen people can access their data and not just have their own data being used for another purpose. So for this, of course, we have two different layers, and this is also something we wanted to discuss. So one of the things that you made perfectly clear, and I will pick up on that, is that many times people are suspicious of sharing data, health data. Of course, health data is maybe more sensitive than other types of data, but so often people share on social media a lot of very personal data, and many times they don't have any idea of how it will be used, by whom, and for which purpose. However, at the same time, in so many countries, if you discuss, for example, a tracing app like we did in the time of COVID, or if we discuss having a health data being shared with a commercial organization, for example, like we just discussed from the survey, most people will say, no, I won't do it. So do you think this is only a question of digital literacy? Do you think it is because people don't know, for example, that in Facebook, Twitter, or whatever, their data will be seen and shared? Or do you think there is a cultural aspect here of something else? Is there any other reason for this distrust or for this different behavior on similar aspects? What do you all think?
Karina, well, the research literacy is actually very, how to say, there are a lot of things about this what is called the privacy paradox, because in most cases, actually, people always say that they are concerned about what is happening with their personal data and how it could affect their privacy, the risks that they perceive. And a lot of researchers have attempted actually to understand why there is this paradox. And in most cases, the things that is, like kind of justification is this trade-off, because actually people, even if they are concerned, what they tend to see is the benefit from sharing the personal data. I am going to share my data, but I'm going to have access to this, for example, to the service. So the benefit is immediate, whether the risk, it's more like maybe it is coming. So there is this, like, it's not sure 100%, but I know that the benefit, I'm going to have it right now. And so people rely on this, okay, I make this kind of trade-off and sharing data. But of course, it's one of a lot of different justifications. And one of also the argument that I see more and more coming in the literature is the resignation, is that, like, people feel really helpless. They feel like they don't have any other choice but to share their personal data in order to have access to a service or I don't know, whatever. So they do it even if, well, they are not completely okay with the fact that they are sharing personal data. So
if we don't consider this last option, because it wouldn't be nice to foster, but if we consider the first one, which is, do we need to show very immediately the benefit to encourage people to share their data if a certain solution, organization, or context is safe enough? Would this be the way to go?
Yeah.
Well, yeah.
Because of what Sarah just mentioned, I think that's why we were looking into a data trust. I do not want to have my own personal data on my laptop, for example. I do want to be in control to decide who gets access to it, but I would be very happy if my data just remains at my GP or the hospital that I go to. In that sense, I do not have the possibility to, when I'm short on cash, give it to Google because I want to have access to that app. So I think we should prevent that. I'm impulsive, I know. If only, and I think there are more people like me, so we'd rather not have access to my data, the raw data, but I do want to be able, like I said, to say who gets access to it. And what really helps, I don't know, there's several programs in different countries, but in the Netherlands, youth data is being collected on a national level, and 96% of the parents give their consent for it because they know that those data are being used to improve youth health for children afterwards. And that is not an immediate return, but it doesn't take much to realize that the way we treat our children now, and it's getting better and better, is a result of the data that people provided before us. Mm-hmm. So in that sense, that's also a way of giving back, and that helps, I think.
Yeah. Let me just tell something before Jana and Nicole also jump in, because I know you want to. Just one question that popped in and says, when we are discussing this, do we feel that patients and citizens and different types of citizens can be treated as one when we are discussing this, or do we need to approach different people and different stakeholders on a different way as well? So maybe this can also be part of your answers if you want to use it.
Sure. I would like to maybe challenge Jeroen slightly with regard to the notion that citizens, people don't want to access their data on their computer, etc. Again, and this points to Bledin's question, because I think you do really need to differentiate between patients living with one or several chronic conditions and citizens out there, because I think patients living with a chronic condition, they want to actually be part of that electronic health record. They want to actually contribute not just clinical outcomes, but other behavioral dimensions of living with a chronic disease to help them improve and advance, but also to contribute to research, etc. And they want to be part of that conversation. And I think there's a lot of evidence out there that points to that. So that's, I think, an important piece to think about. And it's a good illustration of where one has to differentiate between the patient's perspective, patients with a chronic disease, not an acute patient, and the wider citizens' perspective. But I think it's a really important point. I think what is maybe lacking is the representation of wider citizens, because we don't have generally citizens organizations that are organized and structured, and we have to rely on other mechanisms in that regard. But to a couple of other points, I think one of the questions that you had at the end of your survey conclusions was the importance of informed consent and user-friendly informed consent that enables people to really understand what's at stake, what the opportunities are. And when they sign an informed consent, they really feel confident that they've signed something that they've sort of signed up for, as it were, not leaf after leaf after leaf, or something, you know, on internet where they just basically go to the end and say, God, I'll just accept anyway. I can't be bothered with all of this. And until we actually look at that seriously, maybe take good examples from, for instance, the clinical trial regulation work and the focus on meaningful informed consent, and indeed layperson summaries, etc., etc. All of that will point us in a positive direction. I think the other piece is looking at data as a public good and exploring that in further detail, because if we can have a little bit more discourse about the idea that data is a public good and is not only for individual benefit or commercial benefit, but is actually fairly and squarely for societal benefit, then I think that will also help the conversation. And my last point, I think, is looking at COVID-19. Of course, there's been a huge controversies over certain elements, also in my own country, the UK, on test tracing, etc., etc. I mean, lots and lots of challenges. But on the other hand, I think we've never been at a time where there's been more awareness generally about the value of data sharing, to move science forward, to enhance understanding, to get a sense of where the hotspots are with regard to COVID-19 in a particular region, etc. And everybody who's watching the news, and everybody's watching the news these days, let's face it, are seeing these dashboards and understanding that, you know, data is being collected in terms of where the prevalence is, where the risk areas are, etc. So we're in a different environment, I think, with regard to how people generally are seeing data. Sorry, I tried to sort of touch on a few topics there, and it's probably very confusing, but those were a couple of things that occurred to me as I was listening to the conversation.
Yeah, Nicola, that was perfect. Actually, I think we needed 2 hours to discuss, but but I think Jeroen wanted to say something very quickly to respond to you, and then I would pass to Jana, because we'll have 6 more minutes, I think, before the wrap up. So
yeah, Nicola, I totally agree with your point about the way patients feel, and we work together with patients organizations, and they are highly frustrated that they cannot enter their own data that they collect on a daily basis into their patient health records because we do not have the infrastructure. But I was just alluding to the fact that the data should be accessible for me as a patient, but that does not mean that I need to have it on my phone or on my laptop. It should be accessible at any time. I should be able to give permission to anybody to look into it, whoever I want to. But I should not be able to sell it. And I don't think those points are contrary. If you think they are, I'd be happy to take that offline, because I think Karina cuts me off otherwise.
No, I think that's a helpful clarification. That's a great clarification.
I think we already have a reason for a follow-up because we will need to continue this discussion. Please, Jana, jump in because I know you were waiting. Sorry.
Yeah, sure. Sharon's example of not, I think it's more important to focus on access to data and reuse of data, not so much on technical ways, because I think technology advances so fast that we will have alternative ways of getting those rich insights based on data. So very often we focus on technology or infrastructures, but we should maybe more focus on design principles. So the question that, are we treating all patients or all people equal? I think we should separate between different interests and different roles, but also when it comes to data, we should separate between different categories of data. Not everything is sensitive data, although we talk about healthcare and personal data. So I think we need to introduce to the discussion when we want to talk about our digital future, this digital ethics thinking as well. And I saw one very interesting study about integrating care ethics into the digital design or digital ethics as well, saying that actually you need to have empathy, responsibility, competence, and trust in place. And all those four matters should be, they intervene, because others need to trust that you're acting on the data on a sincere and honest basis. And then if you don't show empathy and listen to your end users, listen to your patients, they will not trust you in like forever. So I think we need to focus more on, or join the forces to discuss about how we want to form the digital future and how we want to use these different technologies. So we, instead of talking about if data sharing is necessity, I think we should focus more on discussing how we want to do it.
Yes, that's very true, I think. And I was saying we have a very long question more regarding the EU health data space and if we should anonymize data or if we should identify it or which type of technology, et cetera, et cetera. So I think the full roadmap for us to decide here, which is, I'm sorry, I love the question because it's very thorough, but we won't be able to go through all of it. But the last part is if we have a roadmap for this. And this part, maybe we can say that we don't have the full roadmap, but at least I think we advanced on 2 or 3 nice things today. I will ask of Birgit if she wants to wrap up. I will just advance on 2 things, I think, 2 ideas that we discussed today and that I think are quite interesting. One is that maybe we need representatives from the citizens in the discussions. We don't have it. I don't know what can be that. Nicola addressed it. So maybe we do need some movements of citizens, not patients, not, well, to also be engaged in the discussions and bring the different aspects from different sides of Europe. I think that's a very interesting idea. And maybe we can all be encouraged to put this into motion somehow. Also, very much sensible the idea that maybe what we can discuss for now is a little bit the design principles. And I really liked Jana bringing ethics into the discussion and empathy, because I do think we need more of that in our discussions overall. And as we see from Jerome and Sarah's discussions, there are very different technological ways to address it. So that's good to know. And I think it's very good that you could share it a little bit and put it into the discussion, because this helps to see that we have different ways of addressing it. Maybe these can be as disseminated as possible between all of us so that we can understand all the possibilities. And for sure, and as the last point from Nicola, it is very good that we can have patients being involved on more than just accepting to share data. I think I have to say honestly that I even think there is a section of citizens that would like to do the same, even if they don't have chronic diseases, and it would be good to partner them with patients on this. But for sure, most of the from the patient side, there are a lot of activism, and it would be good for them to be able to really give their opinions and actively access data, not just provide access for the others, although this is of course very important as well. So sorry, but I need to close it in 5 minutes, so I will pass the floor to Birgit and thank all of you for the amazing discussion. I do think we need to have a follow-up, and I will leave this invitation already for 2021, like in a few months when we all can travel, I hope, to meet again and maybe continue the discussion. Birgit, up to you. Thank you.
Thank you, Karina, and thanks to my co-panelists for the interesting discussion. And I think to wrap it up, as was already said, we all align on the need of unlocking health data with the necessary precautions, of course. And the current crisis, I started with that in my introduction, but you should never waste a good crisis, and it helped us to create the awareness on the richness of data and the value of data for research, but also for crisis management and for gathering citizens and the people of a country together in this flattening the curve. So that's really helped, and let's try to make to get the benefit out of this general mobilization on data literacy, let's say, and see data as a public good, as Nicolas said, and that the societal benefit of using the data to move along. And then, as Karina said, I really like this. We're struggling with the citizen perspective in this discussion, and indeed, it's not the citizens as such are not organized like the patients are. So there, we'll have to reflect how we can represent them, voice them correctly with their different roles and hats in the governance of health data spaces or whatever organs we trust to keep our data, to access our data. And the discussion gave also a number of new ingredients when it comes to defining trust, because it's very important, and we all agree that it's very important. But we have to make it more tangible to see when do we trust somebody. And Jana, the digital ethics and empathy component, I also really like that, and that's a new element that we certainly have to take further. And then collaborate, work together, design this roadmap of the European health data space together. I think that's the way to go, to join forces and to build together to make it happen.
So that was a perfect wrap up, Birgit. Thank you so much. We will ask you later to also put it together on a short document that we can share between all of us, because I think some of the ideas are very interesting also to report back on our project and to fit in with the conclusions and the main ideas that we discussed here today. So I think we have 1 minute to go. Maybe we are the most efficient panel, I don't know, today, so, because we could actually end up in time. Bledin did this in the morning very efficiently as well. So that was a really good discussion. I thank you so much for being here, and I do hope we can continue this together. As Nicolas said in the beginning, we really need to team up. We are happy that we are seeing much more people discussing on the issues and with the same alignment, because this is what is needed, I think, so that we can progress and actually do something meaningful during the next few years. Thank you again. I hope we can still be all in touch. And I know a lot of the audience wants to contact some of you and continue the discussion bilaterally. So that's very nice as well. Thank you again. Talk to you soon and keep safe.
Thank you all. Really very interesting discussion. And I pledge that in the DHS we will take away the need for you to speak together and look at ways in which we can facilitate that greater in-depth conversation and work, because the collaboration needed is obvious.